Yeah, so I'm also from the University of Ulster. I come from the computer science department in the university, and specifically we come from a research group which investigate the deployment and evaluation of technologies within smart environments. And that's just some pictures of some of the labs that we have at our university. So we're really quite interested to look at what impact the technologies can have on the support of the ageing population and persons with long-term chronic health conditions. So what I want to talk to you about today, just at a fairly high level, is just look at what sort of technologies are being used in this area and introduce the notion of the smart home paradigm, because I think this is something which is becoming more and more relevant, and look really at what the technologies, trends and challenges are in that area. And from a computer science perspective, look at what the opportunities are of how we can manage and progress and really work with all of the information that we can glean from that environment. And I think I've put two objectives here, just really in line with the spirit of the conference today. Hopefully you'll take away some sort of insight into the technologies that are being used in this domain. And secondly, maybe to stimulate some ideas of how you think some of your technologies or some of your applications might be diversified into some of the work that we're involved in. So I don't want to dwell on this too much in terms of background to our work, but everybody has an appreciation of the growth of the population. In 40 years, we're going to see roughly a 50% increase in the population. So this is really a triumph of medical, social and economic advances over the last century. But with this comes a number of challenges. Challenges for social insurance and pension schemes. And specifically today what I want to look at are the challenges with health and social care provision. So obviously as the population grows, the prevalence of the number of elderly in our population increases, and the prevalence of the numbers of those suffering from long-term chronic health conditions also increases as well. So today, what I'd like to sort of throw out as a question is, can technology be used as an enabler to address some of these challenges? And indeed, how can it be used, and what are the trends? So I think we'd all agree that there are benefits to the management and the prevention of long-term health-related issues like CHF or COPD, Parkinson's, dementia, all of the sort of conditions that we're familiar with. For each of these conditions, there are specific known causes, and there's specific known risk factors that we can address. So what I want to propose is that technology is one possibility of how we can address these challenges. I don't want to give the impression that with technology or with a mobile phone or with sensors we can solve all of the problems associated with all of these diseases. But technology is being accepted as one possible solution that we can put in place to address some of these challenges. Now, I think everybody would agree that technology and healthcare has been around as a partnership for a long time. 1887, Waller recorded the first ECG. Eindhoven in 1903. Hans Berger recorded brainwaves in 1924. Computerized processing of the ECG in the late 1950s by Pitberger. MRI machines in the late 1970s. And then things sort of changed a little bit with Tim Berners-Lee here, not really related to technology and healthcare, but I think you'd all agree the introduction of the web and really the penetration of that in today's society is having a huge impact across a number of domains. And we saw this in 2005 specifically in the NHS programme for Connecting for Health, where a lot more of the transition of technology came from or moved from devices to more of a computational or a software perspective. And what's interesting really in the work that I'm involved in is to look at how this technology is being used and how it's being changed. So a very interesting report prepared by Ofcom showed that on average people in the UK engage with technology for 7 hours a day. So that's a huge amount of time, but it's also a huge opportunity for us to see, well, how could we introduce some new services on top of the technologies that people already use? So it might be a myth that you say someone over 65 or 75 doesn't use a computer or doesn't use a mobile phone. And in fact, this report showed the opposite. It showed that people across all ages of the population use technologies, digital radio, television, media, computer, mobile phones, but to a different extent, or to a different amount of time each day. So if we can take all of this engagement into consideration into the design of the technologies that we want to use or we want to introduce, this is maybe the starting place or rationale for us in some of our work. So this sort of circle shows 4 very simple points, but I think for me it pulls everything together and everything that I'm involved in quite well. So over on the far side we have a blue sort of arrow that shows the age-related impairment. So that's the problems or the challenges that we're trying to deal with. We can take our measurements associated with whether it's blood pressure, whether it's movement, whether it's activity levels. We can process the data from a computational point of view, and then we can provide some sort of feedback to the person in their environment. So it's very important that we have this closed-loop perspective in the work that we're engaged in. And I guess today it's really from a technology point of view here that might be of interest to the audience of how your technology, of how your devices might be used or might be introduced into this specific environment. Now, the problem really that we're facing with, and I think everybody would agree, would be the vast amount of terminology that has been introduced into this area. So we have telehealth, telemedicine, telecare. We have all our E's and M's and P's and C healths. We have personal health systems, ICT and healthcare, ambient assisted living, assistive technologies. Health 2.0 is one of the more contemporary terms. Connected health is quite popular now in the UK. And I think to a certain extent it's given a bad impression on what do we actually say or how do we actually badge the work that we're involved in. And it's really this terminology that ambient assisted living that we've sort of hung our hat on. We followed the work that was really produced by the EU in 2007 when they produced the AAL recommendations or guidance. And I think that this really encapsulates very well the work that probably a lot of people that you'll, if I can go back, that sort of fall under these areas are engaged in. And it's 4 very, very clear, specific points. 1, to provide a solution that's going to improve the quality of life and an increased level of independence. 2, and this is very interesting, to have a consolidation of ICT, the products, the services, and the systems. So to put everything together rather than have silos of the delivery of individual solutions, and to use this actual technology to counteract some of the problems that we see with the ageing population. And the final point of self-management and self-care is really to pass over the empowerment to the person or to the patient rather than rely on always the delivery or the support from a healthcare professional perspective. So if we look at where we are in the spectrum of devices of home-based support, at one end we have sort of a human intervention or care support, and that might be, for an example, someone making a telephone call to say, take your medication. And then we've moved on a little bit where we have technology-based aids, where we have, for example, an electronic medication reminder devices. And this is really where we're moving into this new sort of era of ambient assisted living, where the technology is quite pervasive. We have solutions being deployed on mobile phones, solutions on digital televisions. Our environments are highly sensorized. We have the concept of the Internet of Things. And all of that information around us is being gathered and being used to really improve the experience or the quality of life that we have in our environment. So if you were to go, and I did a quick search on Amazon really, you can buy any of these devices on Amazon today. You can buy a picture dialing telephone for someone with dementia. This is a wandering device with a fall detector. Devices again for dementia patients that if they want to tag various items that they lose throughout the house, medication reminder, day and night orientation of devices. So lots and lots of technology already exists on the market. And what we're really seeing now is a move beyond that of how we can integrate all of those technologies together and all of that information into this smart home paradigm. So we can take from our home measurements from the sensor technology, and that can be something related to healthcare parameters, it can be activity levels, it can be just basic interaction with the environment. We can then process all of the information and consolidate all that together. And this is really where, from a research perspective, the opportunities lie. How can we manage all of that information? How can we accommodate the different types of sources of information, the different types of manufacturers that are there, the different formats of the data? And then how can we actually feed that information back into the environment and adapt the environment? So on a very simple level, we could say we can measure the temperature, it's too high, and with the thermostat we can regulate the environment. So a very simple example, but yet can have quite a profound impact on the person in terms of their quality of life and levels of independence. So maybe to categorize these a little bit more, the types of technology that we're seeing at the minute, technologies to look at assessment of general health status. It could just be a blood pressure device, a pulse ox, weight scales. Assessment of activity levels, very important, and we can take that from custom-made devices, wireless sensor networks, even use mobile phones. We can use devices like a Nintendo Wii, how people interact with gaming technology. Measurements of interaction with assistive technologies. I've showed an example of a medication reminding device already. The use of video technology, I'll come back to that in a second. And then maybe some more of familiar telecare devices that we have of device interaction or monitoring as the person goes throughout the home. So the challenge really, or the opportunity for us, is how do we take all of the information from these devices, process it, and give something back to the person which is in their home, which is going to improve or support them in terms of their levels of independence. So this is an example, a very simple example of how we can create a smart kitchen or a sensorized kitchen. Here we have just some sensing technology that we can place on the doors to monitor if the person has gone into the kitchen, what they're lifting. We can put very, very simple contact sensors on things like coffee, tea, a tilt switch here on a kettle. So from a device point of view, those devices are very, very simple in terms of providing a binary output. But if we look at what we can do with that and take it one step further and look at the sequence of those interactions in the environment, look at the time between one interaction and another, and look at the order of those interactions, this becomes very important information where we can assess the quality of life, and we can also assess factors such as cognitive decline. So we can take a sequence of activities like open the door, open the fridge and lift kettle, and map that on to activities of daily living, which are recognised in terms of we want to assess these of people living in their environment to give a measure of their independence and their health and well-being. So very simply, we can just monitor binary information, map it back on to the description of ADLs, and have a much better understanding of how the person is performing in their own environment. So that's, I would say, that the base level or where things really are. We want to look at how we can progress beyond that. Now, from an activity point of view, it's interesting to monitor. I did test the videos before. Okay. From an activity point of view, it's interesting that we can actually, we can see one part of the slide, but not the other. 5 minutes, okay. So we can monitor just from devices like mobile phones or the accelerometry on a mobile phone, how active or inactive a person is. I had a video here that should have showed a person walking around, and we can generate a footprint of what their activity is in the environment from accelerometry data. So is the person walking, are they sitting? And we see here, we're going to see quite a large change in accelerometry signal when a person falls. So from devices that are available and a person may already have, we can look at moving towards deploying software solutions onto that to process the information that's already being gathered. So, okay. Another possibility for us is to look at the use of video technology in the home and monitor people's activity. This gives the best it gives the really definitive way to identify what a person has done, but obviously with ethical issues and privacy issues, people may not be happy with transferring that information out of the home. So we can look at developing technologies that do all of the processing in the home and then only transmit the relevant information to maintain privacies outside of the home environment. So with all of these discrete sort of concepts, what we want to look at is, well, if we have sensorized data, if we have vital signs data, if we have video data, how do we put all of that together to actually give us much richer or much better impression or understanding of what that person is doing in their environment. And that's really the opportunity, that's really the way things are moving forward in this domain. So, okay. I've talked really about embedding technology into the environment. One other opportunity for us is to embed technology onto the person. And wearable technologies and the integration of sensing technology into textiles, heat regulation into mid-layer garments, and the integration of mobile phones and flexible interfaces into outer layer garments are becoming something which is much more contemporary solutions. And this allows the person to have the delivery of the services inside the home and also whenever they move out of their home environment. So where is that actually leaving us, or where are we moving towards? Well, I said at the start it was from a computing department, so our work is really looking at how we can structure, how we can put all of the data together to give more information from a number of different sources. So if we look at this sort of model, we can have all of our sensing technology at the bottom layer. We can then see, well, what does that mean at an individual level? We can then combine all of that information together, and then we can make a recommendation at the end. So if you think, for example, you can detect somebody has run upstairs, and you can get that information, or if you can detect that someone's heart rate has increased, and you think of that on its own, and yet you put those two pieces of information together, it's much, much different in terms of what the final outcome or what the final recommendation would be. So just to finish off then, we have a number of different opportunities really in this domain when we look at the different data that we can record from the different devices. So we could have video, we could have sensor, we could have activity, and we can have physiological data. At a very high level, we can already consider tracking a person with video. We can look at object interaction from sensor technology. We can monitor activity levels from accelerometers. And with physiological data, we can assess vital signs. At a finer grained level, we can actually see from video, well, what is the motion or what is the actual task the person is engaged in. From the sensor data, we can look at the time in between events, the sequence, and look at, is there a cognitive decline or is there some confusion in completion of the activities. If we look at the accelerometry data, we can generate a footprint and see, is a person walking, have they fallen down, or are they sitting. And then from their vital signs, we can look at trends from a finer grain perspective. So our opportunity really, and this is where our work is sort of driving or moving forward, is to look at the combination of these different forms of data to get a richer understanding of a person in their environment. And that allows us to look at measurements of confusion and activity, spatial trends, increase or decrease in vital signs, assessment of ADLs, all of the important factors that we want to assess the person in their environment. But if we can do it in a pervasive nature, then we take the burden off actually going or requesting someone to go into a hospital or go into their care centre or having to engage with technology all the time. So I think I'll stop there. I really just wanted to give an overview of the types of technology that were being used and the opportunities of really considering those together from a computational point of view. Okay, thank you.
Just before we take questions, is Jeffrey around so that we can sort of line them up for the next thing and maybe start moving there? Thank you. Questions? Yeah, one at the back there.
There's no question that the technology is the enabler, but who's going to be looking at this information and who's going to pay for it?
Yeah, I didn't. I didn't show this slide, but I think the second point on the far is a reimbursement model hasn't been put in place, and there's a number of challenges of why this isn't mainstream from a public healthcare provision perspective. So yes, I think that's an excellent question. It's one certainly I can't answer, but I know in addition to the development of devices, the development of the software, there's an equal amount of effort going into the development of business models to try and realise this solution. So I think it's a very good comment, but unfortunately I can't provide any answer to it.
Other questions? Okay, one at the front here.
I can shout this.
Andrew.
What about the ethical?
Have you got any comments on the ethical implications of this and how elderly people are perceiving them being monitored and being watched and this information leaving their home and things like that?
Yeah. I mean, I think if we had have seen the video play, what I tried to emphasise there was that it is possible that we can mask the data. So we have video at home and we can only look at data which is, it protects the privacy of the person in their home. All I could say to your question at a very high level is that people could opt in or out of this. So if they don't feel comfortable, then this isn't the solution or this isn't the technology for them. So it's not that, and I said at the start, the technology is only one possible solution to these problems. One size doesn't fit all. So if someone isn't comfortable with this technology or the perception of a Big Brother effect, then they're not going to comply. And I think that relates to what Jane talked about in the previous presentation, that if there's a privacy concern and someone's not happy with this, then they're not going to engage with the solution. But what we find is that other people do like the facility or the feedback that they'll get, and then we have the buy-in and the compliance. So I think it's really over to the user or the patient if they want to engage or adopt the solution.
Thank you. Other questions? Chris, smartphones are getting smarter and smarter, and in a sense, if we do nothing, a lot of these problems are going to get solved because the apps will come along and the accelerometers are in there now, and we don't have to make smart clothes because everybody's wearing a smartphone. To what extent do you think these problems will sort themselves out, and to what extent do you think that there is an added layer of research for people like us to do?
Yeah, well, I think it's a good point to pick up on the development of apps for smartphones, because there's been a large amount of effort to develop these apps that are now being considered as medical software, and there's a lot of regulatory issues now associated with all these programs being available on the App Store for people to download. And the FDA have now taken this into, well, they've now become aware of it, and they're sort of blocking people putting their apps on and maybe putting some warnings for people to use it. So in a sense that might slow things down, but what it will do is all of the apps that are actually will come through that process, we can be sure that they're going to actually deliver the solution or deliver the or meet the requirements for the user, what they expect. So yeah, I mean, I think that's another tough question that I've got, but yeah, I don't have a definitive answer for that, Terry.
Thank you. Thanks very much.
Okay.
Thanks so much.